I got to tell you, as a father, I've never been more angry in my entire life.
It's hard to watch as a mother. It was a real slap in the face, having that court win, and then suddenly Tim Nicholls just pulled the rug out from underneath.
He was due to start gender affirming care earlier this year, right before the government came in with this announcement that they were taking it away.
I've got a trans daughter as well, but she was lucky enough to actually get her access before this ban happened, and that medication has saved her life.
It's been a rapidly moving 24 hours regarding access to puberty blockers for adolescents in Queensland. A snap rally has gathered in Brisbane to protest the ban being reinstated. But let's start from the beginning. In January, Queensland Health banned public doctors from prescribing puberty blockers and hormones to new child patients with gender dysphoria. These are treatments that suppress puberty for young people that are distressed by their changing body. The move caused outrage among some families and medical professionals.
There's going to be blood on the politicians' hands because suicide rates are really high, and they're high because they don't have access to gender affirming care.
One mother whose 14-year-old trans child was about to start treatment took the issue to the Supreme Court, arguing the ban was made without following the proper legal process. Justice Peter Callaghan argued the case wasn't about whether the ban was right or wrong. It was about whether the government followed the law when making it. Justice Callaghan ruled that the government failed to follow the correct processes. During court proceedings, it was revealed that the heads of Queensland's public hospital and health services learned of the ban at the same time as the media, and their briefing on the ban lasted only 22 minutes.
The government think that they can just push a pen and let these legislations ride on in without consultation. They did not speak to trans parents, they did not speak to trans people, so they can't do that. This is life-saving care.
LGBTQ+ advocates called the ruling a huge win for trans youth, but the celebration was short-lived. The judge noted that irrespective of his ruling, Queensland Health Minister Tim Nicholls had the power to introduce his own ban if he is satisfied it is necessary to do so in the public interest. And just 6 hours later, the Health Minister did exactly that, immediately reinstating the freeze on prescriptions. Mr. Nicholls confirmed patients already on a treatment plan would remain exempt from the directive.